Dr. Elizabeth Murray, fresh off her shift from the pediatric ED at Strong Memorial Hospital. And you're here because this topic you're so passionate about. You know, with the recent cases of Joseph Lamica, the daycare provider being arrested for child sex abuse, and some other cases that have been, noteworthy recently. You say that we as the public really don't have a good idea of who these potential violators of our children are.
I think, emotion is such a powerful motivator of action, and on one hand it's so much easier to think it's the stranger, it's the guy in the van, it's somebody we know wouldn't do this to our loved ones, but our statistics tell us something completely different. And the key message is for everyone to hear what we know locally, what we know nationally, is that in cases of child sexual abuse, the abuser is well known to the victim in 90% of the cases. 90% of the cases. So it's not that stranger, it's not that weird guy with a truck that we don't know.
Wow.
It is known to the victim.
That is an incredible percentage, and because of that, or at least partly because of that, a lot of times we don't hear
Correct.
from the child. The kid doesn't say anything.
Correct. And then the opposite number is we know about 1 in 10 children are victims of abuse, and fewer than that will ever speak up in their lifetime. So it's really, we know the tip of the iceberg, and we know who the abusers are. We just need to create a comfortable environment so children will speak up, because understandably, if you know the person, you love the person who is your abuser, you don't want to get them in trouble. You don't perhaps know it's bad as a very young child because you were raised in that environment potentially. So there's a lot we can do to empower children to speak up and just have the conversation. Make it normal. We know that we wear bike helmets because it keeps our body safe. We wear seatbelts because it keeps our body safe. We don't let people touch our private body parts because that's our body and we're keeping it safe. It's all the same safety message. If we can remove some of the stigma, I think it would go a long way to helping keep kids safe.
And you know this, and you're passionate about not only as a doctor and a mom, but because you spend at least 1 day a week at Bivona Child Advocacy Center where these cases come in. And in fact, it explains why we have shoes out on the table as well this morning.
Yeah, so April is Child Abuse Prevention Month. It's also a month of the early childhood education too. So we've got a lot of amazing things going on to recognize children coming up in April. But Bivona is going to be having a traveling art installation of 125 children's shoes. That will go from place to place. It's going to be at the mall and the Strong Museum, and the 125 shoes representing the 125 children we see every single month at Bivona. And so I've got 6 pairs of shoes because through Bivona I helped 6 children this week. Just myself as the one provider. So I thought I couldn't bring 125, but I could bring the children that I was involved caring for this week.
But that just 6 kids 1 day.
Yeah, I mean, that's so disheartening. Obviously, people want to do things to help. What type of, are there signs that they can look for if they see a child, maybe a nephew or even a son or daughter? Are there signs that might give away that there's a problem?
Yes, I think, having the message of openness from the beginning with conversations with your children and children in your life is critical. I'm a trusted adult, but then you can see opposites. A child who is very outgoing perhaps becomes very reclusive, or all of a sudden does not want to go to a house where you would think they would otherwise want to go. Perhaps there's a little bit of a disclosure where they're kind of testing the waters, saying, oh, my friend at school said this. Well, take that seriously, because perhaps it is a true disclosure about something you heard at school, but maybe the child is kind of testing to see what's your response to really devastating news, because they want to know, can they trust you? Or are you going to get really upset? Because our emotions tell us to be really angry and want to fix it. But that can be very scary to the child because they don't want to get anybody in trouble. And children have an incredible way of blaming themselves for things that happen to them, whether it's illness, whether it's divorce, or in cases of abuse, children somehow are able to really think, I must have done something wrong. So we need to make sure we're supporting these children. But I think educating the kids first, talking about our bodies, giving our body parts their appropriate names, not nicknames, kind of getting rid of the stigma. It's just so critical.
That, I think, hopefully you can come back sometime soon and talk about how we as parents do that. I'd love for you to come back and talk more about that.
Be happy to.
I think it's a mistake a lot of us parents make. 6 kids. Thanks for what you do in our community.
It's a pleasure.